Good afternoon, Mr. Neal. My name's Lexi. I'm going to be your nurse.
Okay.
So, you're here for your checkup.
Mm-hmm.
So, tell me how things have been.
A little stressful at home. My family wants me to take my medication, and I don't want to. They told me that if I don't, I can't live with them anymore. But it just seems unfair to me that they're forcing me to do it.
So, since you haven't been taking your medication,
Mm-hmm.
your family doesn't want you to stay at home, and you're having a hard time with that.
Mm-hmm.
Tell me about it.
Like they told me that I either have two choices to stay with them and take my medication, or I have to find a new place to live if I'm not going to take my medication.
So, what's been the problem with your medication?
It's just making the voices I hear, which sometimes they're nice to talk to, not as strong, I guess.
Are you missing the voices?
Mm-hmm.
So, in the past, we've seen that it's had some problems with the voices.
Mm-hmm.
And the medication has helped in the past. But you do miss the voices
Sometimes,
sometimes.
especially when I'm lonely.
Have you been going to therapy?
Mm-mm. I stopped that too. I didn't like the therapist.
So you had troubles going to therapy because you
Mhm.
had problems with the therapist.
Mm-hmm.
Okay. What about your group therapy? Have you been trying to go to that?
I don't like that either.
No?
People that are crazy. I'm not crazy. I'm perfectly fine the way I am.
So you just didn't get along with anyone at therapy? You just didn't feel like you belonged there?
Mm-hmm.
Have you been trying to do any outside activities to
Mm.
try and help with the loneliness?
I watch conspiracy theories all day long.
So, and we talked about watching TV,
Mm-hmm.
and how sometimes that cannot be helpful.
I
And
guess
like-
so.
Maybe exercising or
I go fishing.
tell me about what you enjoy about fishing.
Gets me out of the house for a little bit, away from everybody. I don't feel so paranoid. Like people are watching me. I can get away. It's just me.
So your living situation. So you go fishing to help
Mhm.
with some of the negative effects. So what will you do if you can't stay with your family because you're not taking your medication?
I guess I'll just find a ditch. Make a tent out of some stuff.
So you would be homeless.
Mm-hmm. Are we done? I can go home now?
You still have to meet with your doctor.
Yeah, I guess so.
Go over treatment options since the
Mhm.
lithium isn't what's worked best for you, and see what we can go from there. Okay.
I don't want any medication unless it's marijuana. I want that. Give me a medical marijuana card.
Well, it's not legal in Missouri yet, so that's
Well, it's getting there.
not yet. But we're gonna talk to see about what treatment we can work with. Okay.
So medical marijuana.
It's not legal in Missouri. But we'll talk to Dr. Huddleston and see what he thinks about it
Okay.
and go from there. Okay.
I'll talk to him.
So we'll mention how you haven't been taking your medicine as prescribed and that you might need a different living situation. But are you still living with him right now?
Yeah, I'm with my brother and my sister-in-law.
Okay.
they're pretty cool.
So you enjoy spending time with them?
They're alright. Sometimes they're annoying.
Families can be hard to live with.
Mm-hmm.
So I'm gonna go document some things.
Okay.
And I'll take you back to the room when he's ready, okay?
Okay.